Hear from you too, 637-0094. We'll go to the phones now where he's been pretty busy on the Facebook here. Dr. Tom Shieh, good morning, Doc.
Good morning.
Oh, hey, good morning. How are you?
Good, thanks for joining us. Nice office.
Nice helmet.
You're welcome to come and visit.
Right.
I would like to have a tour of your new office.
Yeah, when the emergency declaration is lifted,
Mm-hmm.
we'll have an open house.
All right.
So when's that going to be, in 5 years? So we'll see you in 2024.
30 days.
Okay, Doc, so let's just get right into it. I was on leave, but in checking my Facebook, I kept seeing a lot of posts from you. And like I was telling Bree, we're used to seeing you holding a crying baby. I saw one of those yesterday. But these are posts where you're really continuing this kind of new role of a COVID critic. And so just kind of walk us through some of the criticisms you have of, I know that you had a criticism of the quarantine process, I believe, and then also the formula that they used, right? The formula they came up with, the algorithm to determine if some place is a hotspot or
High risk.
Right, yeah.
You know, that formula only take into consideration very simplistic variables. I mean, there's more variables than just counting positives. First of all, when you count positives, it's not an indicator of how you control the pandemic. Taiwan is a perfect example. And I wrote a letter in my Facebook about Taiwan and how they managed it. They don't just count positives. You know, I think what it's important to know is also add in the variable, the death rate of each individual state. And also, if you look at per capita of 100,000 people, you know, you have to look at each individual state, because one state can be good one day and quote unquote low risk, next 2 days is already high risk. Why? Because there's freeways going in and out of each state. And how do you know that those test positive are actually from that state? By the time they test positive, it could be a transient visitor already out of state. But the point I'm trying to say is that there is no formula or algorithm that's going to fit for every single state. So I think you have to take into consideration each individual area to making sure that we take every single variable into consideration. One of the biggest one is hospitalization and access to care. You have to look at the access to care. If a state has good access to care, and they can have 1,000 positives, but that 1,000 positive is not hospitalized or they're asymptomatic, then you don't put them as a high risk state just because they have 100 positives. So I think those keys variable has to be coming into play. And I did meet up with Mike Cruz this weekend, and I think we both share the same view. Is that he's struggling with some of the PAG members, etc. So there's a lot of politics in play. So we have to take everything that comes out of L with a grain of salt. But what I can say is this: we know our best defense, right? Our best defense is what? Mask, hand sanitizers, right? These are our best defense, and social distancing. You know, 6 feet. Those are all documented to work. So if we know our best defenses of masks, sanitizers, staying away from large gatherings, and staying away from people 6 feet apart, you know, there's really no reason to quote unquote quarantining people who you think may be asymptomatic and are not infected. Because I haven't seen the data, and Chris, I would challenge you to go ahead and ask Gov Guam to get the data out. How many of thousands of people that they have quarantined, and how many of those thousands of people that's quarantined in government Guam facilities and in their homes that are not positive? Right. And if they are positive, how many of those are actively infectious? So those data we haven't seen. So I'd like to see those data. But so far, I think we have just over 300 something positive or 400 positives. So I suspect Gulf Guam has already quarantined over thousands of people. I don't know, 5,000, 6,000, who knows how many thousand. Right. So from those 5,000, let's just say 5,000 have been quarantined over the last 4 months at home and in hotels. How many of those 4,000 quarantined actually tested positive? Mm-hmm. So that's the question that we need to ask. And is it worth it? Is it worth that quarantine? Mm-hmm. I'm certainly in for not locking people up, but if you have a home, you know, stay at home. You know, I've always say stay at home if you don't have to go out. But if you do go out, if you wear a face mask and you keep your hands clean, and if you're symptomatic, don't go out, period. But if you're asymptomatic, if you wear a mask, more than likely, you're not going to get infected. Mm-hmm. And that's a fact. So I think donning a mask is our best defense. and staying away from people, and then let's wait and see what happens, over time. But I think if we can do that, like Taiwan is very good in masking on, and they're able to control their pandemic.
I wanted you to clarify what you meant when you said politics. They're playing politics. I mean, it's kind of scary to think that we would be playing politics when lives are at stake or during a pandemic crisis.
Well, if you really think about when I say politics, if you look at what we're trying to do, we're trying to open up to certain countries, right? So we're here lobbying other countries to say, hey, we'll let you come in for less than 5 days without quarantine, without testing, 5 days. But can you please reciprocate that when they go back to your country and not lock them up? Well, the countries are being lobbied to do that. So those are politics. Those are not science. Those are politics, okay? But what's to say that a country that's low risk that can come in and not going to have somebody who's positive? In my opinion, we should consider every single state in America as high risk, even Hawaii. See, when I mention Hawaii as low risk, based on CDC criteria, they are, because their death rate are very low at 1.8. Guam is higher than Hawaii. But I actually want to consider Hawaii high risk along with the entire America, in the entire United States. The reason why is that we shouldn't consider every state low risk or some states low risk and high risk, because we're all contiguous in a way. Because once they get on the airplane, I don't care if you're from Hawaii or from Los Angeles, if they're sitting right next to each other, if somebody's high risk from Los Angeles and somebody low risk from Hawaii and sit close together and they go to the same bathroom, of course, the risk of infection is going to be high inside an airplane. So I think you should treat everybody the same. Universal precaution is what I'm advocating for.
Right.
So when I criticize Adaloop and I criticize their formula about low risk and high risk, I don't think we should even do that. I think we should treat everybody the same. Universal precaution. That's what I advocate for. Mask, sanitizer, and distancing. I think that's how we're going to get over this, because that's our best defense.
So, Doc, if it's Governor Tom Shieh calling the shots, how would how would you run our quarantine policy? What would your quarantine policy be?
If I was governor,
yeah,
I would declare martial law from the very beginning and lock down the airport. That's the first thing I would have done. Same as Taiwan, is it closed the borders, and then from there, I would get members of the medical community that doesn't have any conflict of interest. And what I meant by that is, if you look at Taiwan have the Ministry of Health, and they actually work with a private physician, a clinic on the outskirts. And the physician and clinic on the outskirts from Taiwan doesn't ask for thousands of dollars just to maintain a tier 2 clinic. Those are voluntary work that we do. And not to say that we want the clinics to go bankrupt, but if you look at all the clinics on Guam, majority, I would say 95% of all clinics on Guam have stayed open to help Guam and to help government Guam Memorial Hospital. So that's the first thing I would do. The second thing I would do is to start looking at what we have as testing capacity. Even if you test positive, so Chris, if you're asymptomatic, all of a sudden you come, I just want to get tested. You test positive. I said, man, Chris, did you have a cold or something back in January? You may say, oh yeah, I kind of remember back in January I had the sniffles. Well, then you could have been past exposure, because we know the PCR test, the one you stick up your nose, is not going to determine if you're currently infectious versus a past infection. So I would use antibody testing to see whether or not you develop antibodies. And more than likely, if you have antibody positive, then you're a past infection. So that's how I would dissect it out. Rather than putting everybody as a positive that, oh yeah, you're infectious, you get locked up for 14 days. So I will try to dissect that out. It is not that difficult, Chris, because we don't have that many positives on Guam. We have over 300. I'm sure that the 300 that didn't come this month, it's over the last 5 months. Yeah. So I think you can dissect that out and look at individual history and where they're from, and really look at that.
I got to ask, so you're writing these letters, you're doing these Facebook posts. Have you gotten any response at all from Adaloop?
Well, I don't look for a response for Adaloop. When I post on my Facebook, it's just for public information and personal opinion. In a way, I kind of feel good about that, because you go to bed and you have a conscience. I've written several letters that, I told you, like Jerry Maguire letters, right? Those memos that he writes in 5 a.m. You wake up, like, oh my God, I hit send. And one of them went to Chris. Like, oh no.
Darn. Did I do that?
Yeah,
how I
but,
feel
you
with
know,
my
I
Twitter.
read this letter.
Oh,
I read this. Chris, I know I'm not going to get any response, okay?
Yeah.
But if you think about it, it does have an effect because now they're considering pre-testing. Now they're considering lightening up the easing of the quarantine issues. But then again, you have to look at other states, and Hawaii have a very simplistic one-page quarantine so that people can read. You expect the public, the general public, to read a 6-page protocol on following the algorithm of your high-risk state, low-risk state, and then coming down here, hey, you got to
I feel for my buddy Dr. Cabrera, because it's like hey Felix, we need to come up with something that says what we want it to say, and he's in there crunching the note. Okay, that's not going to work.
Keep it simple.
Anyway,
Keep it simple so we can understand.
it's like way back, Doc, when they said something about our 5-day rolling average, if it hits this certain level, then we could revert back to prior pandemic condition. But then when it did hit that level, they're like, oh no, we're going to go with a different rolling average now. So I just feel like they're constantly trying to evolve the criteria. But, you know, it's, what is that, Bree?
It is what it is.
It's rapidly evolving. Yeah, Doc. So I know you're not anticipating a response, but and we would just want to bring you on because it generates discussion. Like I'm getting some messages here about, does Dr. Shieh know that he can't declare martial law? Yeah, of course he knows that. The question was, if you were governor, what would you do? And he's obviously not the governor.
If you can't declare martial law and you're the governor of Guam, then so be it. But certainly I was trying to do it and push for it. I mean, we always push for independence, right? We always push for independence. So,
no, Doc, I think, and we'll go back to when we had talked about this at the time. I think it was you, and then the vice speaker had also called for the airport to be closed. And the response from the governor was, I don't have the authority. But imagine that if the governor had come out and said, I want to close the airport because I want to keep my people safe. I think that's something. I mean, even if she couldn't, if she had expressed the desire to maybe want to, instead of just say I can't, But I mean, it's water under the bridge now. It's water under the COVID bridge.
When I talk about dissecting out the positive and trying to figure out who's actually infectious or not, if you look at other states, New York City has started antibody testing right under our nose. The Theodore Roosevelt, who was here and they tested people 6 weeks later, a month and a half later. Even right now, they're still doing antibody testing on their sailors.
Right. They're doing the CDC and the military.
The antibody testing is same as the PCR. It's already FDA approved for emergency use. So we should be utilizing what is under our radar here. Use the capacity of testing capabilities that we have and try to figure out what's going on. There's no harm in doing antibody testing, in my opinion.
Mm-hmm.
And I did post a little meme on the on my Facebook by Star Trek.
A little what?
The antibodies, Star Trek. I like Star Trek because a lot of Star Trek episode actually is coming true in our era. The flip phone that had
right.
that. So we
Doc,
had that.
I'd hate to correct you on the air, but did you say meme?
Yeah, was it a meme?
It's pronounced meme. But a lot of my Chamorro friends think it's pronounced meme.
Hey, I'm from Hawaii, okay?
Yeah.
And if you haven't noticed by now...
He's like, oh yeah, it's a little mimi kawakalaka, Lonnie.
I grew up on the streets of Salt Lake. I went to public school. I didn't have the opportunity to get a big education like everybody else. And let me remind you, I was born in Taipei, Taiwan. So if you can listen to my accent a little bit, I still speak Chinese there. Okay?
What accent?
So, yeah. When I went to Kapilani and there was a soup there, right? So I said, I want the minestrone soup. I said, what minestrone soup? There's no minestrone soup. They go, oh, no, that's minestrone. Oh, okay, well, that's minestrone, because when I learned ABCs, this is how I do it. Minestrone, minestrone. To me, it's the same thing. A soup is soup. Just give me that soup. That's all I want.
Yeah, that one.
Right?
Okay, Doc. Okay,
you know what I mean.
I know what you mean,
of course.
We got you, Doc. Okay, we got to run, though, but thank you so much for your time. And I like getting you on because it gets people talking. We got a comment here. Martial law.
I'm also good with that too,
Dr. Shieh, there's a comment here. Martial law, and he's a former Navy officer. Lost his marbles. I just think that's funny.
Mask on. Sanitizer. If you run out of sanitizer, come to my office. I'll give you a few, okay?
All right, we'll be there after DOC. Thanks, Doc. There you go, Dr. Tom Shieh. Yeah, it's funny. Whenever I talk with Dr. Tom Shieh, I always get all these messages from other doctors who are like, "Hey, whoa, and he's out. He's a little out there. It is.
I don't know. I like hearing from Dr. Shieh, and I like
No, I
hearing
love
his
hearing from.
perspective.
Yeah, definitely. I think that's like I said. There's at this kitchen we want a lot of cooks in here.
Yeah.
But I just want to go back to this martial law, former Navy officer. That would be the military's answer to everything. It's like, lock it down, martial law. Of course he would say something like that.